Hello my dear friends, after completing the external features of the heart, now let us learn about the internal features of the heart. And in the internal features of the heart, we are going to discuss about two important things, the internal features of the right atrium as well as the internal features of right ventricle guys. Now on the screen, whatever diagram you are able to see here, that is the internal features of the right atrium. The right atrium has been opened. Now try to understand, just in our previous video I told you about the external features of the heart. Our heart is like a fallen cone here. Now in this I told you the surface in the front, anterior surface, you will be able to find the right atrium and the right ventricle. Now what we are doing is, right atrium, the anterior wall of the right atrium we are going to cut and we are going to reflect the anterior wall. We are going to open that. We are going to open the right atrium guys. So you first try to understand the orientation here. The diagram on the screen here, it's like anterior wall of the right atrium has been already reflected guys. Now once you reflect that, when you see inside directly you are able to see the interventricular septum. Now why you are able to see that interventricular septum in the middle there? Why? Because guys, just behind the right atrium you will be able to see the left atrium. So between the two atria, the right atrium and the left atrium, you will be able to find the interventricular septum. So I hope you are understanding. So we are cutting the anterior wall and reflecting the anterior wall of the right atrium. Now I will tell you like what all to appreciate here in this diagram, and then afterwards we will be drawing this diagram together. Now in this diagram, first of all, you are able to see here that this will be the superior vena cava, and here you will be able to see the opening of the superior vena cava into the right atrium, and below here you will be having inferior vena cava collecting the blood from lower half of the body, and you can appreciate the opening of the inferior vena cava here into the right atrium. And between the superior vena cava and inferior vena cava, you will be able to find a muscular ridge here, so this one, okay, and that is said to be your crista terminalis. So above you will be having like superior vena cava and below you will be having inferior vena cava. Between them you will be able to find a muscular ridge elevation, okay, and that is said to be the crista terminalis. And that's important guys. Why? Because inside the atrium you will be having a rough part and a smooth part, and both of them will be separated by that crista terminalis. So I hope you are able to appreciate on the anterior wall all these muscles which are actually in the form of comb, okay, the teeth of the comb, okay, and that is the reason why that muscles are said to be the musculi pectinati guys. So in this diagram you are able to appreciate the rough part of the right atrium where you have the muscles arranged in the form of teeth of the comb, and those are said to be the musculi pectinati. Then after that, one more thing to appreciate here, I said you are able to see the interatrial septum. And now in this interatrial septum you are able to appreciate there, that is oval shaped fossa ovalis. So in the embryology part we have already discussed there. Okay, you will be actually having like foramen ovale, and that foramen ovale will be closed after the birth, and then you will be only having the depression there in the form of saucer shaped depression there, and that is known as the fossa ovalis, saucer shaped depression known as fossa ovalis. And right above the fossa ovalis you will be able to find a margin here, and that is known as the margin of fossa ovalis, or else it is also known as the limbus fossa ovalis. Margin of fossa ovalis, or it is also known as limbus fossa ovalis. You can appreciate that on the interatrial septum. Then the last and final thing, one more thing which I want you to understand here. Yes, you are able to see here, there is one more opening here, the opening of the coronary sinus. I told you from your entire heart the blood will be collected by cardiac veins, and cardiac veins will drain the blood into coronary sinus, and coronary sinus will also drain the blood into the right atrium. So there you are able to appreciate the opening of coronary sinus. And then guys, if this is the right atrium, then below here you will be having your right ventricle, and between the right atrium and the right ventricle you are able to see that there will be a cusp, tricuspid valve, and you are not able to see the entire tricuspid valve, you are only able to see one cusp here, and this cusp here will be towards the septum, okay, that is the reason why that is known as the septal cusp. So in the tricuspid valve you will be having three cusps, one is the anterior, another one is posterior, another one is septal cusp, and this one is the septal cusp of the tricuspid valve, okay. So all these things you are able to appreciate on the interior, or we can say in the internal structure of the right atrium. So we'll do one thing here. Once you have understood all these structures over here, let us draw a diagram for this one too, guys. Okay, so start drawing the diagram along with me together. Now from the upper half of the body, blood will be collected by superior vena cava, and from the lower half of the body, the blood will be collected by inferior vena cava. So imagine here, this is your superior vena cava, and this one here will be the inferior vena cava. Now I told you the anterior wall of the right atrium, we are actually reflecting it. So the reflected anterior wall of the right atrium, I am drawing it over here. And on this you will be having the muscles in the form of teeth of a comb, musculi pectinati. And after that, my dear friends, we all know this will be the opened right atrium here. So this is the internal features or the interior of the right atrium. And somewhere here you are having the extension of this one here, and that extension is said to be the auricle, guys, right auricle. Now let us go in the same sequence here. Between the superior vena cava and inferior vena cava, you will be able to appreciate a muscular ridge elevation here, guys, and this muscular ridge is known as the crista terminalis. Crista terminalis. Now one important thing to understand there is crista terminalis is separating the rough part from the smooth part, one thing. And one more thing that you have to understand here, that in the upper part of the crista terminalis, you will be able to find this SA node, guys. In the upper part of the crista terminalis only, you will be able to appreciate the SA node present here. Perfect. Now, apart from that, I told you already, what about these muscles, guys, here? These muscles are known as your musculi pectinati. Musculi pectinati, guys. So on the anterior wall, will be actually rough, and they will be having the muscles in the form of teeth of a comb, and that is nothing but musculi pectinati. Now once you are done with this one, once you reflect the anterior wall, I told you will be able to appreciate the interatrial septum. On the interatrial septum, you will be able to find that oval shaped, saucer shaped depression, fossa ovalis. And just above the fossa ovalis, there will be margin, and that is known as the margin of the fossa ovalis or limbus fossa ovalis. Fine. So I am just writing as FO here. FO stands for fossa ovalis. And above here, this is the margin, and that margin I am just writing as L there. And then L stands for limbus or margin of fossa ovalis. So fossa ovalis, and above that there will be margin of the fossa ovalis. And in embryology we have learned about the septum primum, septum secundum, and how all these are formed. Everything we have discussed in detail in the embryology part, guys. Then after that, here I told you from the right atrium, the blood will be moving into the right ventricle, and between them you will be having a cusp here. And the cusp which is visible from here will be your septal cusp. So this will be actually the septal cusp of tricuspid valve. Septal cusp of tricuspid valve. And apart from that, you'll be able to appreciate here that is one more opening. There will be opening for coronary sinus, which will be like more near to your inferior vena cava only. So try to remember, here you'll be having, this is the opening of coronary sinus, which is collecting the blood from your heart itself. Then apart from that, one more thing that I want you all to understand here or appreciate here is there will be a ridge here, sir. There will be a thickening, there will be a ridge here, and this ridge here is said to be the tendon of Todaro. Tendon of Todaro. Now, what is the importance of these structures? Now, the importance of these structures here is between these three, all these three things are important here, guys. Between these three, that is tendon of Todaro and the opening of coronary sinus and this septal cusp of tricuspid valve. Between these three, you can appreciate a triangle here, and this triangle is referred to as triangle of Koch or Koch's triangle, triangle of Koch or Koch's triangle. So let me just write down here. So what is the name of this triangle here, guys? This is the triangle of Koch. Now, what is the importance of this triangle of Koch here? That is the location for AV node, guys. So, whenever a cardiothoracic surgeon is trying to locate the AV node, yes, that AV node will be located in the triangle of Koch. So, in the triangle of Koch, you can locate AV node. Perfect. And in the exams, always I have seen that for the triangle of Koch, they'll be always asking the boundaries of triangle of Koch, guys. So let me just repeat for the last time. What are the boundaries of triangle of Koch? So number 1, tendon of Todaro. Number 2, the opening of coronary sinus. And then number 3 will be the septal cusp of tricuspid valve. These 3 will be the boundaries for triangle of Koch, which is actually the location for AV node, guys, atrioventricular node. And then on the posterior wall, you'll be also able to find the small openings, guys, like the veins which are directly opening into the right atrium, and those will be the Thebesian veins. Thebesian veins, guys. Okay. So there will be like small veins, okay, which will be directly opening into the right atrium, and those veins will be the Thebesian veins found on the posterior wall. And the last and final thing here, yes, what is this extension, guys? So right atrium, you will be having a ear-like projection there, and that ear-like projection is actually known as the auricle, and that will be your right auricle. Right auricle. So there will be a ear-like projection known as the right auricle, guys. So this is all about the internal features of the right atrium that you have to appreciate here, and there are so many questions which we have covered here. Fine. And at the end of this video, I request all of you to pause the video and see the comparison between like our diagram here and the diagram which is actually given in your textbooks, guys. So once you compare that, then the things will become like very much clear. Everything has been done here, guys. That's all about the right atrium. Now, after completing the internal structure of the right atrium, guys, now let us learn the internal structure of the right ventricle. So we are again closing the right atrium, and now we are going to learn about the internal structure of right ventricle. Now, first of all, again, let us do or learn with the same planning here. I'll tell you all the details in the diagram here, then let us draw our diagram here, guys. Okay. So now in this diagram, we have opened the right ventricle. And again the same thing, you are able to find a rough part and a smooth part here. Same like atrium, even in the ventricle also you will be having a rough part and a smooth part. And you can see here the outflowing part here. This is the outflowing part here of the right ventricle, guys. And that outflowing part will be the smooth part, and that is known as the conus part. The smooth outflowing part will be actually the conus part, or else it is also known as the infundibulum, guys. Now, the blood will be coming from the right atrium, and that inflowing part will be actually the rough part. So, the inflowing part will be the rough part and the outflowing part will be the smooth part. And these two are actually separated by a ridge. Okay, appreciate this ridge over here, this one, this elevation here, and that is said to be the supraventricular ridge. So, supraventricular ridge will be separating the smooth part from the rough part, guys. Now, the only thing that you have to learn here in this topic here is that, okay, in the right ventricle, you will be actually having muscles, trabeculae carneae muscles, and trabeculae carneae muscles are actually divided into 3 categories, guys, the ridges and the bridges and the pillars. So, we will do one thing here, let us draw this diagram and simultaneously I will tell you about all those points, guys. Okay. So, let us start drawing the internal structure of the right ventricle. So, suppose this is actually the right ventricle which is opened here, and the blood will be flowing out via the pulmonary trunk. And here you will be having a supraventricular ridge, or we can say the crest. Supraventricular crest, and it is the one which is separating the smooth part above, which is known as the infundibulum. So, the smooth outflowing part is infundibulum. Okay, and the inflowing part from where the blood is coming in is the rough part. I'll tell you the details about that one, guys. And here I told you there will be a tricuspid valve. This is the tricuspid valve, and this is like one of the cusp of tricuspid valve, sir. Fine. Now what about the muscles? What about the muscles inside the ventricle? Those muscles inside the ventricle will be trabeculae carneae muscles. And once you open that, somewhere here you will be able to find the trabeculae carneae muscles. The elevated muscles are actually known as the ridges here, sir. Trabeculae carneae muscles. Now these trabeculae carneae muscles inside the ventricle will be actually arranged in three forms. You'll be able to find certain muscles, just elevated muscles, guys, and those will be ridges. The muscles which will be in the elevated form, ridges. And then number two, the second category will be the bridges, the muscles which are actually connecting bridges, and finally the pillars. So all these muscles are actually arranged in the three forms, the ridges, bridges and the pillars. And you people know very well or very famously these pillars as papillary muscles, guys. So let me even write down that one here. Pillars are nothing but your papillary muscles. Fine. And these papillary muscles are in turn divided into three categories, guys. The one which are present anteriorly are the anterior papillary muscle, and posteriorly the posterior papillary muscle, and on the septum there will be septal papillary muscles, sir. So the papillary muscles are in turn divided into three categories, the anterior one and the posterior one and the septal one. Now for example, if there is a papillary muscle here, guys, we will be having the, like pillars. There are certain papillary muscles over here. And these papillary muscles, from the tip of the papillary muscles, what is going to happen? There will be cord-like structure. I will just show it only on one papillary muscle, guys. From the tip of the papillary muscle, there will be a cord-like structure which will go and join with the free end of the septum, the free end of the cusp, the septal cusp. Okay. So that cord-like structures which are going to connect the papillary muscles with the cusp here are known as chordae tendinae. These cord-like structures are known as what, guys? Chordae tendinae. So from the papillary muscles there will be cord-like structures joining with the cusp of the tricuspid valve. And because of the contraction and relaxation of the muscle, what will happen? The opening and closing of the valve will be taking place, guys. Is it okay? Now, apart from all this, the most important thing which I want all of you to understand here is that there will be bridges, and out of the bridges, the muscles which are acting like bridges, connecting, out of the bridges, one of the largest bridge, guys, which is going to connect this papillary muscles here with the septum here, guys, interventricular septum. So that is actually the septomarginal trabeculae. Just appreciate here in this diagram. Yes, this is septomarginal trabeculae, or it is also known as the moderator band. Okay, has been asked like many times in your exams. So this one here will be the septomarginal trabeculae, or else it is also known as the moderator band. Now what is the importance of this one? Why it is being asked a lot of times in your exams, septomarginal trabeculae or moderator band? Why? Because that is the one which will give the passage to the right bundle branch. So when you study about the conduction system of the heart, you will be having SA node, AV node, bundle of His, bundle branches. Out of that, yes, right bundle branch. The passage to right bundle branch or the right bundle branch is actually passing through the septomarginal trabeculae. So passage to the right bundle branch is via the moderator band or septomarginal band, guys. Understanding here? So that is the clarity about all your trabeculae carneae muscles. I repeat this once here. Let us just summarize very quickly here, sir. Trabeculae carneae muscles inside the ventricle will be divided into three categories. You will be having ridges, and then the bridges, and then we will be having the pillars. And pillars, those are nothing but your papillary muscles, and papillary muscles are in turn divided into three categories, guys: the anterior, the posterior and the septal. And in that, the tip of the papillary muscle will be connected to the cusp with the help of a chordae tendinae, cord-like structure known as chordae tendinae, guys. Okay. And one more small MCQ here, one more thing. Out of the three categories of papillary muscle, the anterior, posterior and the septal, which one is the largest one? Remember, the anterior papillary muscles will be the largest one, guys. So that is all about the details that you have to know inside the right ventricle, guys. And again, the same thing at the end of the video, try to do one thing, compare our diagram with the diagram given in the textbook, guys. That will make everything clear for you. That's all.